Procedure, we need a pair of gloves, we need a drape, and we need cotton soaked in antiseptic lotion so that we can sterilize the area, and we need local anesthetic agent so that we can anesthetize. Here no doubt we are doing it on cadavers, but when we are doing it on patients we need to have the local anesthetic agent. And this is a scalpel in order to cut the skin and the chest wall, and this is the chest tube. As you can see, this chest tube is 24 in size. We get right from 20 size to 32 size. Depending upon the patient weight and height and the age, we are going to change the size. For this cadaver, now today I am using 24 size. As you can see, the ends of this tube has got holes. So we are supposed to insert this end into the pleural cavity. And when we are holding with the artery forceps this end of the tube, make sure that we should not project it beyond the tip of the tube. If you do that, it is going to injure the lung or the pleura. So make sure that you are going to clamp with the artery forceps way behind the margin of the this end of the chest tube. The other end we are supposed to clamp it with the artery forceps so that whenever we put this chest tube into the pleural cavity, the pleural fluid or the air or whatever blood containing blood substance present within the pleural cavity is going to gush out. So it is going to spill over the floor and on the person who is doing. So make sure that you are going to clamp the other end of the chest tube. Now this is a drainage bag. So we are going to connect this drainage bag to the this clamped end of the tube, and we are going to open the clamp so that whatever the collection is there in the pleural cavity is going to come and get collected in this bag. And this one is a suture material. This is a 1.0 Vicryl. We are going to secure the tube with this suture material, and this is a dressing gauge, and this is the plaster. We are going to insert the chest tube in the fifth intercostal space, either in mid-axillary line or in the anterior axillary line. So how we are going to locate the fifth intercostal space? Let us see. So this one is suprasternal notch and this is sternal angle. So sternal angle gives, on either side of the sternal angle there is second rib which is attached. So just below that, this is the second space, third space, fourth space and the fifth intercostal space. See, we are going to go in this fifth intercostal space in the mid-axillary line or in the anterior axillary line. So one has to keep in mind that whenever we are putting an incision, we are supposed to put the incision at the upper border of the lower lip. Why is that? Because we very well know that the costal groove holds the neurovascular bundle. If we place the incision here, that is at the lower border of the upper rib, we are going to damage the costal neurovascular bundles. So for that reason, we are supposed to put the incision at the upper border of the lower rib in the mid-axillary line. Let us see how we can insert this chest tube in the cadaver. So for that, as I told, we need to locate the fifth intercostal space. To start with, this is the suprasternal notch and this is the sternal angle. So attached to the sternal angle is the second rib. So from there down, so this is the second space, this is the third space, this is the fourth space and this is the fifth space. When we come down, so we are going to slide our finger feeling for the ribs and the space. So in order to go in the mid-axillary line or the anterior axillary line. So this is the space we are looking at. So this is the fifth intercostal space. So once we have located that, we are going to sterilize that area with an antiseptic lotion. Then we are going to take the scalpel, and as I told, we are going to make the incision at this is the upper rib and this is the lower rib. We are going to make the incision at the upper border of the lower rib and an incision covering around 1 to 2 inches. Once we have done that incision, we are going to put our finger, do the blind dissection. See, whenever we are putting our hands or cutting through the scalpel, the chest wall, the following layers are pierced. From outside to inside, the skin, then the superficial fascia containing the fat and the muscles of the chest wall, and then the intercostal space muscles, that is the external intercostal, internal intercostal, innermost intercostal, and then we have the parietal pleura, and once we inside the parietal pleura, we are inside the pleural cavity. So once we have located the space and did the blunt dissection with the tip of our hand, as we have already kept ready the intercostal chest tube. So I have told you how to hold it. We are going to hold it like a pen. So we are going to insert that in an upward direction. So once the tube is little inside, we are going to take this forceps out of it, and we are going to keep, or we are going to slide the tube inside the pleural cavity. Okay. So once we have done that, the next step is to connect it to drainage bag. So this is a drainage bag. So we are going to connect it to the drainage bag, and only once we connect it, then only we are going to remove the clamp. So we have connected it to the draining tube. Okay, we are going to remove the clamp. Then now the next, let us see how we can insert this chest tube in the cadaver. So for that, as I told, we need to locate the fifth intercostal space. To start with, this is the suprasternal. Now the next step is to secure the chest tube. So for that, we are going to take a skin bite like this. Okay, and then we are going to take this suture material around the tube like this 1 to 2 times, and then we are going to secure it. So this is how we have secured the tube in its place. We are going to take it off the needle, and then we are going to put a gauze, pre-cut gauze, and then we are going to apply the plaster. You need a better plaster, the surgical plaster, to put in order to secure this in place. As you can see, the embalmed fluid which is coming and getting collected in the bag. See here, you can see the fluid coming.